Hi, everyone. Welcome to this episode of MedTech Minis. Today, we're here with Jonathan, who's the CEO and founder of Gabi SmartCare. Jonathan, it's such a pleasure to have you here. Tell us a little bit about you and about the problem you're working to solve.
Yeah, hi, Susie. Thank you for having me today. Yeah, of course. So, I built Gabi SmartCare with my co-founder based on a personal experience. 7 days after birth, I almost lost my daughter because of a very strong virus. Obviously, she couldn't tell what was wrong, and she's been admitted to the ICU. She stayed there for a couple of weeks, and then at discharge, physicians asked us to pay attention to specific symptoms because relapse would be possible. And actually, it went wrong. She got some complication, and she was readmitted after that. And really, as a parent, I didn't get that kind of medical education. I didn't get any medical support, and I really felt completely helpless. And I didn't understand why the continuum of care wasn't there. And so that's really the purpose of Gabi. That's why we decided to build Gabi, to really ensure the continuum of care and bring care to home for every kid. That's what we want to do.
I love this. And because if you're going home, and I'm so sorry that happened to you, it shouldn't be happening to anybody. But if you're going through this, I know that other parents are as well. And I hear this so often in the pediatric world where they're sent home and there's no real guidance on what to do. I love the fact that you've created this device. I think it's so important. So tell us a little bit about the technology that you've created.
Yeah, of course. So, well, actually, the main component is the platform. So we have this connected care platform that collects data from the patient, which is at home. And we convert all these data. So we collect these data from remote patient monitoring tools and health assessment questionnaires. And we convert these data into actionable insights for physicians. Now, when a physician really need it, when the hospital doesn't have the structure to look at these data, doesn't have the staff to do so, we also have an external team that can actually look at the data, do virtual consultation, and that kind of service additionally to make sure that we offer a frictionless service. So that's the objective. Now, you talked about a device in your previous question, and it's true. We had to develop our own device because we couldn't find anything that was actually reliable on a child. So we did build something that was miniaturized enough to fit any kids from birth to basically, at the adult stage actually. And that was also accurate. So that's really part of the product. But that being said, the platform now opens to other devices. So we can actually also integrate some other devices that are medically reliable. And so we can serve more patients, more people.
That's so awesome. I truly love this. And I love the fact that you have a device. Like I've seen the picture of it where it goes around a tiny baby's arm. So the fact that you're making something that's really specified toward pediatrics is huge. We don't see a lot of people innovating in this space. Tell us a little bit more about some of the use cases that you've seen, while you're working with hospitals.
Yeah, of course. So yes, the solution that we have is FDA cleared from up to 12 years old. And so we do commercialize it right now to hospitals. We're actually working with about 30 hospitals across the US already. And we have different indications. So we have a lot of tractions from congenital heart defect patients, for example, after the first surgery, making sure that we can follow them up and detect any complications. But we can actually help hospitals as well with acute respiratory issues. Like every single year you have this kind of crisis that hit all the hospitals that saturates their capacity. We currently have a project ongoing with a pretty renowned hospital where we're trying to build a program to help them manage that flow of patients. But we also have some other programs around chronic respiratory, and actually sleep is also a big thing. Like right now, we can provide like sleep tests at home in a very non-invasive way and actually pretty cheap way too. That's a very big use case too.
Yeah, I think that's huge. There's so many people that aren't looking at that, and sleep apnea can cause so many problems later on down the line if you don't catch it early and take care of it. So I love that you're doing that too. It's kind of one of those things that's also a little bit overlooked, I think, in the pediatric space. I love this. I think there's a tremendous amount of use cases for it. I'm so thrilled that you're on the market, and I hope to see you working with every pediatric hospital in the US and beyond. How do people get a hold of you if they need more information?
Well, you can definitely email me, or you can also go on the website, www.gabismartcare.com, and there's a contact form there, and we definitely receive your request through that. website too.
Fantastic. Thank you so much for being here today. I really appreciate your time.
Of course. Thank you so much for having me. Have a great day. Bye.